Hello there, listeners. It's Susie New from the Australian Society of Anaesthetists, and thank you for listening to our podcast. It's called Australian Anaesthesia, and it's where we talk about all things relevant to anaesthesia in Australia. I'm currently recovering from a cold, so please excuse my voice. But in this episode, I am chatting with Dr Evan Kumarakurusingham, who many of you may not have heard of before, and that is because he's only just starting his anaesthesia career. But gee, you wouldn't know it from the way he has approached his career path so far. He brings so much maturity to this conversation, to his career, because he's had to bring it to his life. He talks about entering medicine having a pretty good idea of what kind of clinician he wants to be. I'm not talking about what specialty, but in terms of the human being, the person he wants to be for his patients. And what makes you reflect on that so early on? By being a patient yourself. We've all been there, consumers of healthcare as well as providers. But when you have a lifelong health issue, especially when you've had it from since you were a child, then yes, it's natural to have experiences that shape what kind of doctor you want to be. Dr Kumarakurusingham has type 1 diabetes, and I found myself, during our conversation, continually reassessing my assumptions about how people show up to work and in life. See, I had a friend in med school who also had type 1 diabetes, and he went on to become a very good surgeon. It's only now that I can appreciate what it might have been like for him. Sure, it might have been easier to get back on the surgical training programs back then, I'm not 100% sure. But we did some pretty long hours in our resident years. I'm not talking about like in my mum's generation who would do 36, 48-hour marathon weekend shifts. But we were working before the Safe Hours campaign that introduced CAPS, and we'd be easily clocking up 100 hours a fortnight. So I'm only now really starting to appreciate the challenges he might have faced in navigating all of that. I really don't know how he did it, but he did. Maybe my friend back at med school had, like Dr Kumarakurusingham, someone that he knew, someone that he could look up to, someone that he could actually see was juggling the same issue, juggling a demanding workplace as well as a health condition. Because I think that is one of the reasons why Dr Kumarakurusingham was happy to do this podcast with me. So that other people who might be in a similar situation can see that it is possible. It makes it perhaps a bit easier if you can see someone who also shares something significant with yourself, able to fulfill their dreams that are similar to yours. So our hope is that if you do have a chronic health issue, that you know that you are not alone. My hope is also that if you do not have any such problems, any chronic health issues, that you gain a better understanding, some empathy towards those in our workplaces who do carry that around with them. And also, I also hope that you appreciate how fabulous it is to be healthy. All right, let's get into it. Thanks for giving up some time this morning. We are chatting because you have an interesting background.
I do, a bit different, yeah.
But let's find out, where are you at the moment in your anaesthetic career?
So currently I'm a BTY2 trainee, post-primary exam.
Congratulations.
Thank you.
And today we're talking because you have got type 1 diabetes.
Yes.
When did you get diagnosed with that?
So I was 8 years old. I think in going back and looking at when type 1 diabetics are normally diagnosed, it's a bit late, and that's pretty consistent with my ethnicity. I'm Tamil Sri Lankan, so often type 1 diabetics in that ethnicity are diagnosed a bit later in life.
Okay.
So we have some residual pancreatic function, and then it usually drops off at about puberty.
Uh-huh.
But I was a bit earlier, so 8 years old was when I first was diagnosed.
What was that like, being 8 years old, you're in primary school? Mm-hmm. What were some of the things that you had to contend with at that age?
Diabetes was a lot different back then to how it is now. So there was no continuous glucose monitors like what we had now. So it was all capillary blood glucose testing. And back then there was no insulin pens either. So it was all drawing up separate insulins with syringes and administering it.
And how were you with needles? Because I know a lot of 8-year-olds aren't great with needles.
I was pretty fine with needles. I still remember when I first got diagnosed, they gave me this little bear with all of the injection points and used to practice on the bear.
Aww.
But the actual injections itself, it honestly wasn't that bad. Mm-hmm. It was a lot more obtrusive back then because you had to carry your cloudy and clear insulin vials separately and then draw it up. It isn't as easy as it is now. So like, for example, now, if I really don't want people to know that I'm injecting myself, I can just go into a bathroom with my insulin pen and administer it. But back then, you'd have to be often in a public place wiping the top of your vials with a little alcohol swab and then drawing it up so everyone could see.
Oh, yeah.
And also the area where I kind of grew up in when I was younger was a low socioeconomic area. So, people often would gawk at you. But I think now it's changed so much compared to how it was.
For sure. So you were back in Sri Lanka when you got diagnosed?
So I came to Australia when I was 1.
Okay.
But I was actually symptomatic in the last week of my trip in Sri Lanka with my family.
Oh.
And then came back to Australia, went to the GP and got diagnosed.
I see. And then you mentioned cloudy and clear insulin. That's news to me. What's that about?
So just going off memory back then, I think that it was the quick-acting insulin and the long-acting insulin were kept separately. And so I would mix them in the one syringe and then administer.
Okay, and it was a reusable ampule by the sounds of it, like it is now.
Yeah.
And was there back then a bit of a stigma that needles and syringes were to do with IV drug use or...
Well, I think it was just more where I grew up because there was a lot of IV drug use in the area. And so especially when I reached puberty, being out with friends and then drawing out insulin with syringes, people would often stare.
Yeah, right, because they're thinking that you're shooting up in the middle of a public place or something like that.
Yeah,
well, you are kind of shooting up insulin,
though. Yeah, just subcutaneously.
Exactly. So, something that you need to sustain yourself. Yeah. And then in terms of things like exercise, going through puberty, having growth spurts, affecting your diet, how cognizant were you of those things?
Diet was always ingrained in me from a young age because my mum is a type 2 diabetic and she's a nurse. So she was very much about diet, portion control, which is very hard to do when you're from a Southeast Asian background and your main kind of carbohydrate is white rice. So I think diet was always ingrained. Same with exercise. I was lucky that I had a family that prioritized that when I was younger. But I think as you move through school and as you get older and you introduce things, especially post-school like alcohol, that can really negatively impact your diabetes. I think that was a struggle. And also I think having the freedom to, when you can leave your house, when you have your own money and when you can buy what you want to eat, I think that was a lot harder when things were less controlled.
There's a few developmental stages through there, isn't it, from going from an 8-year-old to an adult. And I know other parents of children who've got type 1 diabetes, the teenage years can be pretty rough. There can be a lot of resistance to the diagnosis, a lot of risk-taking behaviour that you already get with adolescence, but now you've got this other, consideration. How was it for you? Have you always been accepting of having diabetes or, was there moments that you just felt angry or didn't accept it or?
I would probably say from the age of probably 16 to 22, I was kind of in a denial phase where I just pushed the diabetes to the back of my mind. I ate and drank whatever I wanted, wasn't exercising. After the stresses of year 12, then going into uni where it was the opposite and you could essentially do whatever you like. Meeting new friends in uni as well. I definitely went through a period of time where it was like a denial period. And I think it was probably after that period having to then go back, reassess, set goals for myself. I think that's what probably set me up for who I am now.
Yeah, that brings a lot of maturity. I do a bit of work with women in leadership and having to go back, reassess, look at who you are. That's something that people counter later in careers.
And I think boys, we often mature probably later.
Yeah, true. From high school, did you go straight into medicine?
No, I didn't. So I did postgraduate medicine. I took some time off, then did biomedicine and then went into medicine.
It sounds like you were pretty keen on becoming a doctor quite early on, or doing medicine at least. When did that happen?
I actually wasn't, when I was post-year 12 and before biomed, I think I definitely leaned more towards the arts. And it was really after a big hospital admission in my middle 20s that was not related to the diabetes. That made me reassess and think about a career in health. But I still wasn't sure at that time if I would do medicine or if I would do paramedicine or nursing. I had no idea. But I was pretty open and then just kind of fell in love with the sciences when I did biomedicine, and then that led me on to medicine.
Obviously, it's hard to subtract the diabetes from your life. Mm-hmm. But have you had many thoughts on how it might have impacted you as you learnt medicine?
I think being someone who has kind of a long-time chronic illness and having those regular hospital appointments, dealing with different health clinicians and different kind of hospital staff probably helped me follow that journey into the practitioner who I would want to become earlier than getting into medicine, because I had a lot of interactions in the hospital system from an early age that really made me think, oh gee, I would love to be like that person. Or on the flip side, I would not want to be someone like that person. So it really made me have those thoughts earlier on, much earlier than getting into medicine. And then I felt like when I was in medicine, it was just so much easier for me to be able to understand patients with these kind of chronic illnesses, because I could really understand, the frustrations, or even the patients that presented in that denial stage that I was in. It was so much easier to be able to have a conversation with them.
Do you ever disclose to your patients that you have type 1 diabetes?
I actually do. I remember I had a teacher when I was in medical school who said that, we shouldn't be disclosing anything personal about ourselves to patients. But I'm going to come out on a limb here and say that I think with our generation, or the younger generation, I think that we really appreciate having that connection. Because I feel like with us that the barrier between doctor and patient seems to be much less now than what it was.
Yeah.
And so I feel like, if I do have a patient with type 1 diabetes, especially one that's just about to be anaesthetised, I often roll up my sleeves and I'll show them my sensor and say, hey, I'm a type 1 diabetic as well. I've had surgery as well. I'll make sure that when you come out, your sugar levels are okay. We'll get you checked in recovery. It just makes that rapport-building stage so much easier.
That's an interesting comment about one of your former teachers telling you about not disclosing. I agree. I think that the times have changed. I will often say something that might relate to my patients. I'll say, especially if I'm anaesthetising a child that's similar to the age of my child or something, I'll be like, yeah, my daughter would say that too. Things like that. I think the kids often like it. Obviously, I don't say it to every kid, but the ones that when the moment is right.
Yeah, I think it really highlights the human connection.
Yeah, exactly. Do you think having diabetes impacted your decision to pursue a career in anaesthesia?
I think in a way it did. I was kind of thinking about this the other day before we were going to sit down and have this chat. And originally I was like, no, it didn't. But I think it did, because it definitely allowed me to take out some careers as a definite that I wouldn't do, more just because it wouldn't fit in with my lifestyle. For an example would be general surgery. I don't think I could get through the unaccredited years as a type 1 diabetic. For myself, of course, everything that we talk about here, this is just applying to me and type 1 diabetics. I'm sure it won't apply to other people with type 1 diabetes. But for me, I knew my own limitations. For me, the workload wouldn't have so much been the challenge. It would be scrubbing into a surgery if there was a complication and the surgery was going for double the amount of time that was originally scheduled. That would be a big problem for me. Because I would think that as a registrar in that stage, it would look pretty bad if you unscrubbed, re-scrubbed, and then were also trying to get onto a training program.
Gosh, it's a shame that we can't better accommodate, isn't it?
Yes, but unfortunately, people can be often remembered for the inconveniences that they cause rather than the good things that they do, and that's the reality. I hope that it will change one day, but at the moment, that's just how it is.
Certainly having worked with you and knowing your work ethic, I don't think it's a work ethic problem.
No, but sometimes with this condition, there are certain barriers, and I've just felt like with anaesthesia, it's always allowed me to be able to be my true self. Even as a medical student, I kind of knew when I rotated through that this could be a career that my condition wouldn't be a limitation for.
So with your diabetes in mind, you had certain careers which you thought you wouldn't be suitable for, and you thought anaesthesia would be a good fit. Mm-hmm. What was it about anaesthesia that you thought would make it a good fit?
I think for me, all the way through medicine, I really wanted a career where I could put the patient kind of at the centre of everything that I was doing. And I think that a lot of different medical specialties have that, but for me, it really came through with anaesthetics. I think going into anaesthesia, having never have been exposed to it, a lot of the things I always heard from people is, people go into anaesthetics because they don't like talking to people, or, their patients are always asleep. But that could not be further from the truth. I think that you have to be really good with people and a really strong communicator to be able to take someone who's probably at one of the most scariest times in their life and then in the shortest amount of time make them comfortable with the fact that you will be making them unconscious and then supporting them through their surgery. And I think it's not only the general anaesthesia that scares people, but it's the pain as well. As someone who's experienced it, I had a bad fall about 2 years ago and broke 4 ribs.
Oh, ow.
And so I think that's another thing that people are worried about with surgery. So to be able to take someone and guide them through that, watching that from the outside as a medical student definitely made me think this is a career I would love to do. And now being in it, it's definitely very rewarding.
Well, we're very rewarded having you be in the specialty too.
Oh, thanks, Susan.
Now tell me, because I'm such an able-bodied person, You know, we've worked together. You know how much I love talking about going to the gym and exercise and da-da-da-da-da. So paint me a picture, because I have a very, very little idea about what it might be like to have something that is a part of my life, which would perhaps make me, I don't know, doubt my physicality. What's it like? What are some of the things you might worry about in your day-to-day life, for example?
The best way I can describe it is the two kind of bad things that can happen to me in a day. Either my sugar levels are too high or they're too low. When they're normal, I feel fantastic, and I probably would feel how I would feel if I didn't have diabetes. If they're low, the best way I can describe it is it's that feeling that you get the day before you're going to get the flu, where your brain just feels foggy, your body aches, you feel like you're walking through almost a fog. Everything feels really thick, and that's the feeling that I feel when my blood sugar levels are low. Often the problem is when they're low, I'll then eat jelly beans or sugar. And when they swing the other way, it's kind of like that feeling that you get after a really long run, being like dehydrated, having a bit of a headache. And so that can be a struggle. So it's taken me a while to be able to, I guess, plan my day so that my sugar levels are at a particular level before eating. But it could mean that, you know, something as simple as having a normal sugar level and then bag masking a patient, it being slightly difficult and needing a bit of a prolonged bag mask, and even during the intubation it being a little bit more prolonged, can result in low sugars. It honestly can be something as simple as genuinely not having the strength to be able to give a good lift with a laryngoscope if my sugars are low. It's never been a problem since training, but I definitely feel like as a resident, as a critical care resident, it was something that I really had to work out how I would manage my sugar levels, because our days start really early. And so it could be something as simple as now, instead of eating at home and then taking the 30-minute drive to work, I eat at work. So that just means that my sugar levels are much more stable. And as well, I think one of the things that we were talking about in theatre was the continuous glucose monitor. Now I can just look at my phone and check my blood glucose levels, look at the trend, see where they're going. And if I need to, I can just top up before I go into theatre.
Did you ever have a time when you doubted if you could pursue anaesthesia or any other medical specialty?
I think all in all, I'll say no, but I definitely had days when I felt like there would be easier things to try and do. I didn't want the condition to be a reason why I couldn't do something, because there's so many amazing people who have diabetes, Olympians, for example, that don't let it stop them. It's definitely been something I think that I've had to think about, but I don't think for myself, I wouldn't consider it as being a big barrier.
You mentioned the Olympians as a role model. Have there been other experiences, people, conversations that have helped you just think, no, I've got this, I can do this, or whatever you need to say to remove any sense of doubt?
For me, I think the thing that really solidified, no, this is definitely something I can do, was when I was a critical care resident and meeting Prof. Story. I think for me that was a big turning point, because I was like, here's someone well into their career, well respected, has done so many amazing things, and they've managed just fine, so I can do it too. And I guess that's why that representation matters so much.
That's true. I suppose for people who don't know, Professor David Story, president of the college, is also a type 1 diabetic, and he's been on this podcast and shared that information as well. And it's great to have that visibility, and important, because you don't know who's listening. So there's certain things, for example, that when I went through training, I would have just taken for granted. Doing runs of nights, exams. Do you have to do something different in terms of preparing for those things?
I'll give an example using the primary exam. I did not have the luxury of being able to sit in my room all day and focus on just studying. I really had to plan my day around breaks, around eating at the right time, and around getting out and exercising a little bit every day, because there was no point in me trying to actively remember something if my sugars were starting to drop, because I wouldn't be able to study. So for me, that meant short 1 hour blocks. And I would usually wake up early and try to get those short 1 hour blocks done by about 1 p.m. I think that meant that I was definitely happier during primary study, and I had an amazing study group as well. Closer to the exam, I think the last 3 months took a bit of an impact on my health. But that was something that I had spoken to with my endocrinologist beforehand, and I was willing to sacrifice that small amount of time to just get through that exam.
You're describing a whole lot of things that are good to do for your health and well-being for anybody, but particularly, like I used to anaesthetise neonates and small children much more regularly than I do now. And I always say to the trainees, if you can anaesthetise a neonate, if you can get the finesse and keep that finesse and take it into your adult practice. So I feel like you're looking after your health at that way we anaesthetise a neonate. You got the finesse. You're doing it well. And if everybody also did it that well, we'd also be hopefully healthier and happier. Does that kind of make sense?
That does make sense. I remember my mum telling me something along these lines when I was younger. So she was saying, if you look after your diabetes, regularly check your sugars, you'll probably end up being healthier in the long run than someone without it, assuming that, your sugars are normal. Because it's always something that you're thinking about rather than something that you just think once every 3 months when you go get a health checkup.
And it's like when we were working together and you said you had your CGM and I was like, I'm thinking about getting a continuous glucose monitor because I just want to see what the impact of diet and exercise is on me. And when you said that you weightlifted and you had diabetes, I thought, wow, you are going to know about nutrition and how to balance nutrition and exercise.
Yeah, and I think definitely during that time, when you're weight training in the gym, your caloric intake is something that you definitely think about as a non-diabetic and a diabetic. But it was always about finding different food groups that I could eat that would keep me full, but that wouldn't spike my sugars. And I know there's the whole low GI thing, but I often found that some of those low GI foods, especially now having a CGM monitor, led to spikes in my glucose. Even simple things like fruit. There's no difference for me eating half a mango and eating 4 little squares of Cadbury chocolate.
Yeah, yeah.
So I guess it's just those small things, being able to see the impact that it has on your blood glucose having a CGM, and also acknowledging that it's not as accurate as capillary blood. But it's definitely been interesting for me because had that not existed, I would have been eating half a mango much more regularly rather than eating chocolate, thinking that this was the healthier option for me.
Yeah, I agree. I'm Cambodian, so I have a lot of relatives and they go back to Cambodia and they eat mangoes all the time because they're in season. And they're all like, why do I come back with all this weight? All I did was go there and eat fruit. And I'm like...
Because the tropical fruit is so sweet.
That's all you did is you ate tropical fruit, which I don't blame people for doing that because tropical fruit is delicious. So.
Delicious, yes.
It's not as healthy as you think. There might be people listening who maybe don't have diabetes, maybe have, or maybe do, or maybe have some other chronic illness. What sort of tips and advice might you give somebody who is contemplating a career in anaesthesia or any other career in medicine?
I think for me, the two big things are having a really good regular GP that you see and just having a rough plan of what you're going to do to achieve where you want to be and the time course that will take you. So that was one thing that I did very early. I did that in internship and I plotted where I wanted to go and how long it would take. And that just gave me a good, ground base in setting everything else up. And I think that's probably the biggest advice I give people because otherwise you either go into things too hard too soon or you leave things too late. And it's often in those periods of really high stress that your condition is affected the most. And then that impacts your performance. So I think it's planning at a time so that you can peak at the right time. And also just make sure that you have everything regarding your condition under control so that you can perform at your peak also.
Good points. What did you do, or did you do anything in terms of letting people know?
I think I was lucky in that the place where I did my critical care residency was also the place that I did my introductory training. So everyone in that centre already knew me and the fact that I had type 1 diabetes, but it was definitely something that I let consultants know early, just in case I needed to duck out of theatre quickly to eat a muesli bar. Or it's even some things that we don't think about, like on days when my sugar levels are high, I need to use the bathroom a lot.
Yeah, of course.
They're just things that you don't think about. And so you don't want to be, every 30 minutes ducking out being like, sorry, can I use the bathroom, if people have no context. So I just let people know and I was comfortable with doing that. Some people might not be, but for me, it was never an issue.
Do you think about what life will be like after you've specialised, after you've got your FANSCA, in terms of juggling your career? That's a big question.
I think I have. At the moment, I'm thinking about getting through training.
Of course.
But I guess one of the things I've thought about is what life would look like, having the flexibility to work 3 days a week, for example, and how different that will look instead of what my current kind of landscape looks like. I think the flexibility will definitely leave a lot of options open. And I don't want to say easier because I don't know what life will be like after, but I think that definitely having flexibility will make life at least easier from a diabetes standpoint.
Yeah. Like, for example, you wouldn't roster yourself on for 5 nights in a row.
No, because nights really do throw my sugars out of kilter, and then it often takes a week to get them back to normal, and then I'm on nights again. So
I don't think any specialist rosters themselves on for a week of nights once you've got your specialist ticket, even without diabetes. It's not joyful. Look, I've learned a lot.
I'm glad.
Chatting with you. And I really do hope that people out there who are listening who might have a chronic illness, who are contemplating what life is like in a specialty, listen to this podcast and hopefully take something away from it. Hopefully we can help get people in contact with you if it's something that they want to discuss.
Absolutely.
Is there anything else that you would like to add about having diabetes, being an anaesthesia trainee, approaching life with a chronic illness?
I think the only thing that I can say is, if you do have diabetes or a chronic illness, I think anaesthesia is a fantastic specialty and something that you should definitely consider and not rule out.
I think it's a wonderful specialty. So I totally 100% agree. Look, it's been wonderful chatting with you. Thank you. Thanks so much for your time today, Evan.
Thanks, Susie.
Well, I hope you enjoyed that conversation and got some more insight into how things might be for our colleagues with chronic illness. And if you have a chronic illness yourself, then I hope that hearing from someone with that lived experience hopefully has given you that confidence boost. And when you think about it, we do it amongst ourselves when we are approaching big changes in our lives. And I'm talking particularly about having children here. I hear registrars talking about it amongst themselves, as well as asking consultants who've recently had children about how they manage to juggle the whole thing. And mothers groups that we have here in Australia are a great example of a peer group, bringing together first-time parents who live in similar areas to support each other simply by sharing that time and experience together. We have a similar offering here at the ASA. We do have peer groups that you can join, and we do offer peer support training if you're interested in leading a peer group. I do believe that Evan might have also done that training. He's certainly expressed that he's happy to chat with other people navigating a chronic health issue and anaesthesia training. So if you're looking for peer support or to become a peer supporter, then you can register your interest via the ASA website. Otherwise, if you want to continue this conversation, then 3 further podcast episodes for you are episode 115, where I chat with Dr Lanwar Lee, who's the current chair of the ASA's Wellbeing Advocates Group. She's going through some of the supports that are available through the ASA, which of course include peer groups. I also have a podcast specifically on peer groups. That's episode 23 with Dr Kushlani Stevenson, who's the author of the OG peer group document, which she developed on behalf of the Wellbeing Special Interest Group. While we're talking about the Wellbeing Special Interest Group, there's a whole playlist of wellbeing podcasts that I have made that is on their webpage. There's episodes there where I chat burnout, coaching, failing exams, substance misuse, all sorts of topics. So it's a curated list, and of course I'll share a link to it. The other thing that Evan stressed was the importance of having a good GP, and I wholeheartedly agree with him. So much so that I chat in episode 108 with Associate Professor Magda Simonis about all the ways a GP can help you stay healthy throughout your career. Remember, preventative health means seeking care while you're well and not waiting until you are sick. Evan and I, in case you didn't pick it up, are also really into fitness and nutrition. I recently had a patient in the pre-admission clinic facing major surgery after a cancer diagnosis who asked if I had any recommendations when it came to diet and exercise. I was able to share my thoughts, and it reminded me of a paper that showed that doctors who exercise are more likely to talk with their patients about exercise. It's always been an interest of mine, and I know a few expert people. So if you'd like me to do more podcasts on these topics, let me know. Drop me an email on podcast@asa.org.au. All right, I hope you also feel a bit inspired to look after your own health as well as the ongoing hard work that you do looking after the health of your patients. You only get one body to live in on this planet, and I hope that it lasts you a long time. So stay safe, stay well. Thanks for listening.
This has been Australian Anaesthesia, produced by the Australian Society of Anaesthetists, with many thanks to host and editor Dr Susie New, with music by Soda Lime Music, sound and engineering by Bearview, and graphics by the ASA Communications team. For more content, please visit www.asa.org.au.